So this is the video on the Hospital Hilario Galindo in Retalhuleu, Guatemala. So here's some photos from the outside. It's all single level. I visited here on February 21st, 2025. So here is the area where sort of the staff, that would be us, will park our things. Meals are served here, lunch is served here. There'll be shelves for personal items. Supplies will be stored elsewhere. Here's where the workroom will be, where we will do our medical charting, much like we've done at the other hospitals. And this is adjacent to the operating room. So here is the area where all 4 ORs doors are together. Here's a still picture inside one of the ORs. You can see they're reasonably sized. This is one of the anesthesia machines. There's isoflurane as well as sevoflurane. And they have mechanical ventilation, and they're used about 16 weeks a year, so they do get use, and they're maintained. So here's what those look like. They've got supplies, basic supplies that are readily available. We do have electric cautery, which is functional and is available to us. Here is Sala 3. So here's operating room number 1. This is a full-size room, and we've got a regular OR table, we've got back tables, we've got shelves. So here are the anesthesia machines. Okay, we've got cautery, and then we come out into the main area here. This is where all of our scrubs are. We've got scrub sinks. And then OR2 is the same size as OR1. And then 3 here is a little bit smaller. It still has an anesthesia machine. This could be one where we could do local anesthetic cases. We've got another sink area in here for cleaning. And then we've got OR4 here, where the ceiling is a little lower, but other than that, it's still pretty good size. So that's the OR. So I'll get another close-up of the anesthesia machines. We've got isoflurane and sevoflurane. Okay. All right, Ariel, let's keep going. So this is the recovery area. That's the PACU up there ahead of us. This is the preoperative area, which is just off of that as well. The hospital provides staff in pre-op. Here's PACU again. Pre-op nurses come from the hospital.
Yes.
So here's pre-op, and they'll start the IVs unless we want to.
Yes.
And then this is the post-op area.
Post-op area. Each bed will have the monitors. There's oxygen. And now, usually the teams will bring the post-op, the PACU nurses, unless there's a need for us to help with that, then we can help with that too.
Okay, so for supplies, so things that we would bring would all be able to go in the room here, and we would be able to stock these shelves. And then this area here in the corner, FIP brings a standard pallet. And so Ariel, what all is on that standard pallet?
In the standard pallet, we'll have basically the drapes, the covers, everything that you need to get the patient ready. We'll have the anesthesia supplies as well, the circuits, the filters, the syringes, EduCats. I mean, basically all that information, all that supplies that you require for the patient. We also have a standard pallet with medication, so that's the PO medications or the IV medications, the isoflurane or the sevoflurane, so the gases. So it's basically all the basic stuff that you need to get the surgery for the patient.
To get started, really, right?
Started, yes.
And now what about suture?
Sutures and the specific supplies for each surgery and the different specialties, we ask the teams to bring those kind of supplies.
Okay, and that includes suture to close the wound?
Yes.
Okay.
Patient unit area, so they'll bring the trays with the instruments. We'll have the staff from the hospital here, and they'll receive them, and they'll get them clean, washed, and then they'll pass into the cleaning area. And once we do that, and then we'll bring them here to the autoclave.
And how long does it take to run an autoclave cycle? The question really is, how long does it take to turn over a pan of instruments?
40 minutes.
40 minutes.
40 to 45 minutes, yes.
Okay.
So we have the staff here, and they get them ready. Once they're ready, they'll put them in the shelf here, and that means that the trays are ready to go.
Okay, great. So this is the pharmacy where we keep the medications, including the oral and the IV medications that are used. As we move out here, Ariel's going to show us where the patients stay.
Say next patient and whatever name, and they'll be sitting out here.
So this is the waiting area. The patients will wait. The patients will wait out here.
Yeah.
Okay. And then that goes back in. That's where we went back into the surgery pre-op area.
Here in a minute, but I want to show you
all that again.
So in the side area here, we have 2 big rooms. This is the shelter. We call it Casa de Milagro. It's the shelter for the women that are coming for the mission. They can stay there as many nights as needed. They usually come 3 days or 4 days before the mission starts, so that we can get the pre-op work ready for the mission. We have the women's area and the men's area, and they'll look after here.
And how many men? How many beds?
We have about 60 to 80 bunk beds in each side. So
60 to 80 women, 60 to 80 men.
Yes.
Now, what about for children?
They also stay here with their parents. So we don't have specific like cribs for the kids.
Right.
They stay with the parents.
I understand.
Yes.
Okay. And that's all right out here.
Yes.
But that's these areas right here. The women on one side and the men on the other. Okay. So here's what the interior of the Casa Milagro looks like. There are bunk beds, and they use community bathrooms and community showers. This is the instrument room. Es la sala de instrumentos.
Sí.
This is a minor set.
So this is called a little set. You can see it's got basic forceps, as well as some basic scissors, needle drivers, and some towel clips. And we're going to look at some more of these in detail here. There. And now we're going to look at, what do we call this one?
¿A este cómo le dijo que le llamaba Mariela? The minor set.
This is also a minor set.
So this is called like little surgery, literally, like that's
Little?
what she called it, little surgery, and this is a minor set.
Okay, and how many little sets do you have?
She has 3 set up, but there is a lot more instruments so that we could build.
We could build more. And how many minor surgery
De
sets?
estos minor menores, ¿cuántos tiene? 10. 10.
There's 10 of those.
10 of this.
Perfect. So I went ahead and opened up one of these minor sets to see what they have here. In addition to what's in there, they have trays with lots of Wheatlanders and heists that they can add to any of the minor sets for us. All right, so this is the minor surgery set here. It includes this rack here. So we've got needle drivers. We've got a couple different pair of scissors. We've got plenty of clamps. Also right angles. Got a couple of toothed Adsons here. We've got some sends. We've got some blade handles. We've got rat tooths. There's a weedy here. And then in this set, this is great. So you've got your crickets, and we've got all kinds of Wheaties. We've got 3-4 Wheaties. We've got 4-4 Wheaties. We've got the little tiny guys. We've got the heists, and we've got Gelpies. And so, as you said, there's 10 of these, right?
Yeah.
There's 10 of these sets here, 3 of the little itty bitty tiny ones. And so these retractors here, you said we could add to the sets. Mm-hmm. Okay.
As you wish.
Perfect. So the idea would be that for hand surgery, we can use a lot of the instruments that are already at the hospital, since these sets are about 80-90% of what we need to do soft tissue hand surgery, and even some basic bony surgery. I did get a chance to go through the instrument room and see what else was available. They do have some curettes. There's a couple of osteotomes, not a big selection. They have a roll of cerclage wire here. As far as tools that are available, there's some air-powered instruments that are available. They've got this air-powered instrument, a couple of attachments. For a Jacob's chuck, they have the chuck keys. This is a air-driven drill and reamer. Standard air attachments. We did talk about the air hoses. They can get us a nitrogen tank, so we can get these to be functional. We didn't get a chance to test them out at my visit, but we can test them out beforehand. There's also battery-powered equipment that FIP has that we can borrow from the other hospital so that we have power. There are a couple of saws. These are larger saws, but they look like they have got the standard blade attachments to them. So that's the air-powered tools that are available. Here's that whole box that they had there. But overall, we can also borrow from other places. Going back to the common areas, this is the cafeteria for the patients. Out back, they have generators, both diesel and natural gas generators, since there is sometimes a power loss. There's about a 12-second, 15-second delay, but they do have backup power source in the event of outage. So moving on over to the clinic area. So clinic is done on the first day. We call it triage day. The patients come in here and are checked in. This is the waiting area. And then some of them obviously wait outside because the weather's quite nice. Here's where the clinic rooms are, as well as the pharmacy. The pharmacy is pretty well stocked. So let's go take a look around here, and we'll take a look at some of the rooms. Okay. This is a typical exam room?
Yeah. So if we have all the clinics taken in the inside part of the building, then we'll set up anesthesia here in the outside. We like the shade and the breeze flowing, so they just
like tables and
tables, and they just screen the patients here.
Okay, great, perfect. Next, we'll look at the X-ray facilities.
But if not, this is the hospital. So
Okay, so but a patient, we can if they come without an X-ray, we can get an
we
X-ray.
can get an X-ray. Yes.
Okay, and then same with the ultrasound machine, we can
Yes.
use that also.
Yes.
And if we see them on Sunday and they need an X-ray, how long does it take to get an X-ray?
¿Y solo la imagen?
No, 5 minutos ya está.
If you want like the radiology report, about an hour. If you don't want the radiology report, you just want the picture, about 5 minutes. 10
Okay,
minutes.
perfect. So we could get them on the day of.
Yeah.
Okay, great, perfect.
Y tenemos radiografía los domingos que estamos haciendo evaluación.
Cuando sale el trip, sí va. Ron viene.
Okay.
And are they digital or are they on film?
Digital.
Digital. Perfect. Great. Perfect. Next, we had a look at the laboratory facilities. Basic labs, complete blood count, basic metabolic panel, coagulation studies, normal. Okay. Next, after the lab, we looked at the inpatient ward.
If he's not here, Dr. Axel will be called and requested to be checking on something specific. But there is always a doctor here.
And it's staffed with nurses.
It's staffed with nurses. Of course, checking on the patients and making sure that they're fulfilling the orders that you have requested.
Okay. And do they have medications available?
They have medications available, yes, as same as IV fluids, monitors,
Narcotics, morphine?
narcotics if it's needed, yes.
Okay. Okay. Part of the reason why the hospital was empty today on the day of my tour is the last surgical team just finished, and they are in the process of turning over, getting ready for the next team. So here are the nurses outside of the ward. So that's it. Next, I went and had lunch at the hotel where we'll be staying. It's a very nice, actually resort. It's a Guatemalan resort. It's all walled in, fenced in, gated. It's quite nice, well kept. The food is quite good. And here's some of the areas where we'll be staying and we'll be eating. And this will be our home base for sleeping and eating throughout our stay. So that's it. That is the tour of the hospital as well as the location where we'll be staying.